I'm just going to speak out my model of when I combine Ayurveda with allopathy. I call it as Alloveda. Allo means allopathy because I'm an allopathic physician, and Veda means the knowledge which I've acquired from Ayurveda over a period of time and how I integrate it in my practice without medicines. For a medicine, I'll refer it to an Ayurvedic doctor, but there are certain principles which I feel an allopathic doctor can understand. So Ayurveda talks about Vat Pitta Kapha, and we have an equivalent of Vat Pitta Kapha in allopathy. Ayurveda talks about Rasa Rakta Mamsa Medha Asthi Majja Shukra, and there are equivalents in allopathy. If we combine the two together, there are certain unanswered questions in allopathy which I am being able to answer using Ayurvedic principles. For example, a person gets tumor, either he gets a stricture or he gets an ulcerative tumor, or the same patient gets a fungative tumor. In allopathy, I have no answer. Which patient is going to get which tumor? But if I use Ayurvedic principle, I know with the Vat personality, he will get a strictures. With the Pitta personality, he will get an ulcerative tumor. And with the Kapha personality, he will get a fungating tumor. Second, if I find a Vat personality getting a Pitta type of a tumor, I know this patient is not going to respond to my allopathic treatment. He may require a complex. It will be a Sadhya Rog as far as Ayurveda is concerned. Today, I don't know why typhoid causes myositis, why typhoid causes blood involvement, high ESR. So the answer from Ayurveda comes is any disorder of Ras will have involvement of Rat, Mamsa, Medha, everything. Every disorder of Mamsa, muscle, will spare the plasma and the blood, will involve the bone and bone marrow. That means using principles of Ayurveda, I am being able to help in my practice to prognosticate, to detoxify, to help to reduce the medicines. It is possible to reduce medicines for hypertension and diabetes by 50%. It is possible to reduce healing by 50% by combining. I'm not talking about Ayurvedic drugs, that's not my field. I'm talking about Ayurvedic principles alone. It is possible to do that. Say Dr. Trehan will agree that when a patient presents with acute myocardial infarction, we say acute heart attack can present with pain, with burning, or with discomfort in the chest. And as an allopathic doctor, somebody asked me, if a patient comes and asks me, मेरे को heart attack होगा तो दर्द होगा, कि burning होगी, कि मेरे को discomfort होगा, can you tell me? In allopathy, I said, I have no answer. But if I use Ayurvedic principles, I know a person with a predominant Vat personality, which is a movement personality, will develop pain, chest pain. With a Pitta personality, will have a burning. With a Kapha personality, will have a discomfort in the chest. So I can speak for it for hours. But there is a possibility. There is a possibility where if I am taught, see, Chanakya Niti says, अपने दुश्मनों के बारे में सब कुछ जानो. अनफॉर्चुनेटली हमारे को एलोपैथी में आयुर्वेद के बारे में कुछ नहीं पढ़ाया जाता. और अगर हम अपने दुश्मनों के बारे में उनकी वीकनेस और स्ट्रेंथ जानना चाहते हैं तो मुझे मेरे मेडिकल करिकुलम में दवाइयां छोड़ के सारी पैथीज की नॉलेज मेरे को आनी चाहिए. आई एम गोइंग टू एंड विद वन सेंटेंस, एंड माय सेंटेंस इज, जब भी आपके शरीर में चोट लगती है तो जो आवाज निकलती है वो आ ई उ ए औच है. कभी भी आपके मुंह से क ख ग च छ ज नहीं निकलेगा. Vowel chanting produces interleukin 2 in the body. Now Ayurveda says vowel chanting, and allopath doctor says allopath chanting produces interleukin 2 in the body, which is the strongest painkiller in the body. Whenever you weep, you chant a sound called nasal consonant. Ma, na, ga. These are weeping sounds. Weeping sounds are nasal consonants, and weeping sound chanting produces delta activity in the EEG. Therefore, if I want to combine an aspirin and a compost together, I need a vowel and a nasal consonant. Therefore, Om chanting, if added to allopathy, is a therapeutic option and not a Ayurvedic or a naturopathic. Thank you very much.